Good afternoon, everyone. TJ Alt, I-45 now. Great to have everyone along as we have our weekly visit with Dr. Philip Keiser, the local health authority for Galveston County, to talk about all things COVID-19. Big news, Dr. Keiser, coming out right before you and I came on the air today. A huge announcement from the state of Texas. Every adult now eligible starting on the 29th of this month to go get their COVID-19 vaccine. It has been limited in these kind of classifications, but it all opens up on the 29th. Talk about how big of a deal that really is for folks like yourself who are making sure people get vaccinated right now.
Yeah, this is huge. And this is huge because it means a couple things. First of all, it means we're getting into the end game of getting people vaccinated. And I think that's really important. So far, we've vaccinated about half the people in our county. Well, we've started the process, about half the people in our county. Half the people have gotten at least one shot in their arm. And we have used a wait list where we've started off with people that are, initially over 75, then 68, then 65, then 60, and people with conditions. And I got to tell you, it's actually very difficult to be constantly recruiting from this pool of people that get smaller and smaller, and also to make sure that you're making the judgments right. Is this person eligible? Is that person eligible? What happens about this, that, or the other thing? So this simplifies our life a lot more in terms of just getting people invited. So if you sign up on the wait list, you're going to get an invitation. You don't have to wait much anymore. And we expect that, given the amount of vaccine that's coming, we'll be able to get through what we have to do within the next month.
And again, if you're just joining us, this is our weekly visit with Dr. Philip Keiser, the local health authority for Galveston County, talking about all things COVID-19 and the big news coming out of the state today. That's starting March 29th. The all adults will be opened up for the COVID-19 vaccine, and is what could be a much more serious game changer. Dr. Keiser, just talk about, you talked about the numbers there that 134,000 Galveston County residents have been vaccinated, at least with the one shot so far along the way, a little over 50% of the population. But there's also been a huge number, just what UTMB has done, not in Galveston County only, but also in Brazoria County at this time, a huge number coming out of there as well.
Sure. So UTMB's done over 150,000. Galveston County Health District has done probably 30 to 40,000. And remember, these are federally sponsored programs, so we have no requirement that you live in our county or even in our state. We've had people come from California. We've had people come from Maryland. I was asking the person who runs the appointment system, what's the farthest away address you've seen? And they actually told me it was Botswana. Now, did that person travel from Botswana, or were they working at UTMB or going to college at Rice or something like that? We don't know, right? But people can come from anywhere to get these vaccines. So the numbers that we've given actually are much higher than what you see reflected in the county statistic.
So the big news coming out, obviously, March 29th, that all adults can go and get the vaccine. Now, as we go along the lines there, what has been, it's one thing to say, yes, everybody can go get it. But is there going to be enough vaccine that's out there to be had? Because that's been one of the issues, is having enough to put shots in the arms. Will there be enough to meet that demand? Because we're pretty certain we're going to probably see a surge here, correct?
Well, I hope so. I hope we see people signing up, and I hope that we get to the point where we get everybody to sign up this week, and next week we don't have enough vaccine to do them all, but that we can do them over the next week or two. Keep in mind that the state's getting more vaccine, and then also AstraZeneca is going to go to the FDA. So we will probably, within the month of April, have 4 vaccines available, which will dramatically increase the number of people that we can get vaccinated. So we're asking everybody, if you have any thought of getting vaccinated, sign up on the wait list. And we think it's not going to be a long wait. I can also tell you that the past 3 weeks, we've had trouble filling up our appointments because, one, of the limitation that we've seen, that we can't do people under 50, but also we're getting up against that mark of about half the people who really wanted it have gotten it. And so now we're getting into those folks that are reluctant. So this is a good opportunity that if you're reluctant or you know someone who's reluctant, get them vaccinated. Say, I'm going to go get vaccinated. Why don't you come with me?
Right.
And right, or grandma, come on. I know you can't use the computer, but come on in and we'll get you vaccinated. And I'll take you. I'll get mine too at the same time. So this makes things so much easier, not just for us in trying to scheduling, but also makes things a lot easier for people who have families that are multi-generational, and instead of having to take this person to this place at this time and another person another place at that time, you can bring the whole family as long as they're over 16 in and get them vaccinated.
Now, one of the things, speaking of that, because we have a question right off the bat from Nancy here. Let's bring it up. She says, so it's saying 16 above, both Pfizer and Moderna, or 18 and above? Because at one point you have one that says, only 16 above, another 18. Is it going to be based on what that condition is of that specific vaccine that will matter?
Yes, it will be what vaccine we have available. We have a lot of the Pfizer vaccine available. In fact, we've been giving more of that than any other. So we're saying to sign up 16 and above. Now, we're not going to invite you to come to a vaccine center that you're not eligible to. It still happens occasionally, and when that happens, we redirect them and give people new appointments. But Moderna is 18 and above. Johnson & Johnson's 18 and above. We don't know what AstraZeneca is going to be, but it'll probably be 18 and above. So we do have that little bit of wiggle room. And so we're saying for the wait list, 16 and older sign up, and when you get the invitation, we'll try and sort everything out by then.
And that's the big thing. The wait list is where you got to start, and that's on your screen now. That you can go to utmbhealth.com/vaccine or call 877-389-2318 to sign up. And then from that's how the designation, you'll get your invite to go ahead and to come for the vaccine. Anyway, so that's will be how you can sign up for that. You had mentioned too about AstraZeneca. Let me ask you about that. There's been some news. There's concerns about the data used, and as it gets ready to go to the FDA authorization. Two-part question here is, one, what do we know about the AstraZeneca Oxford vaccine that's being used in Europe right now, but not in the United States, hasn't been approved here yet? But the other is that when you hear this type of news go on, does it concern you that folks will think, well, if that data is outdated, what about the others? Can you talk about the process? Because I think a lot of times folks are seeing this process for the first time and not realizing this actually is not an unusual concern to be brought up during this. It's just usually it's kept and not everyone's really following it during the time.
Yeah, no, this happens all the time when new drugs are developed. So just keep in mind that each one of these products is separate and unique in its own right. And while they have a lot of similarities, just because there's one toxicity with one or a concern with one doesn't mean that it follows over to the other. So we've had the Pfizer vaccine for the longest period of time. We have millions upon millions of people that have been vaccinated with it. And vaccine reactions are being followed very closely. And I can tell you that with the Pfizer vaccine, what we've seen is that it pretty much was as built, and that a small percentage of people will get some reactions. I got a reaction. I had a sore arm, and I certainly, the second time I had the vaccine, I felt a little feverish and achy, and stayed home and took some Tylenol that day. And then the next day I felt fine. People either fall into that category or the category where they don't have any problem at all. So, you need to be expecting that as part of the process. But we have not had vaccine deaths that have been clearly associated with this particular vaccine. Similar with Moderna, I think the general feeling is that some people with Moderna tend to have more reactions, particularly in their arms, and there's some people that are having sore arms that last more than a day or two, that can last 4 or 5 days. There's been people who have had a red arm for about 5 days. But again, that's a minority of folks. Most people get their shot, they're a little sore, and then they do fine. J&J, we did see that people were having a little more vaccine reactions, and that they were, feeling a little dizzy and feeling like something wasn't quite right. But it did not turn out to be a big problem. We didn't have to send a lot of people into the hospital. And, we gave probably about 5,000 J&J vaccines. So, as these things go on, not only do we as providers see this and take note of this, this data gets reported to the CDC, it gets reported back to the manufacturers, and people look at it all very carefully. Now, when we get to the AstraZeneca vaccine, initially when it came out, there was controversy over its efficacy. And the way they designed the trial, there were mistakes made, and they had to pull back on that. And so now they presented their information as saying, look, here, we've answered all these questions. But I think you got to pay attention to this data safety monitoring board, because what a data safety monitoring board is that it's a group of independent scientists. And your job, if you're on that board, is to any drug that comes out, any study that's being done, you look at that independent of the drug company, of the FDA, of anyone else, and you say, this is what we're seeing, these are the recommendations that we're giving. So now that the drug is going to, or the vaccine is going to the FDA, the independent board, which is not the FDA, by the way, saying, hey guys, you need to take a closer look at this, because this is not what we've seen. This will all get sorted out at the FDA when it goes to their hearings. The hearings are public, and when they file, that's the time we always know what's really going on, because that's the time they have to present all their data to the FDA, and it falls into the public domain, and everyone has a chance to look at it. It'll be interesting to see what happens. On one hand, we need the vaccine. We want to get more people done. On the other hand, we already have 3 vaccines which are safe and effective. So it wouldn't surprise me if it goes a little bit slower than the other 3, in large part because we have alternatives available. Unlike with Pfizer, where we had nothing and the rush was to get it out. And both Pfizer and Moderna have done very well, and J&J's done well too. So we're in a good spot.
In fact, you talked about on the J&J that on the Johnson & Johnson vaccine that you had higher demand for that than you expected.
Oh, yeah.
And that go in there. And in fact, we had someone, Doreen, who's actually commented a couple of times here. She's asking, is there going to be more J&J? Because we're still seeing more Pfizer, more Moderna coming in here. And because of this demand, do you think we'll see more of that Johnson & Johnson vaccine come into the marketplace as well?
Yes, unequivocally. So what happened was J&J had 4 million doses at the time it was approved. That got completely pushed out. So all of that vaccine was used. We went through 95% of it in the first week and probably the other 5% in the second week. So we don't have any left. And most places are like that. But J&J has developed their system so that they're going to start pouring out more vaccine. And they've subcontracted with Merck, another very large pharmaceutical company, to make it as well. So between the two of them, I suspect probably in April or early May, we will see a lot of J&J vaccine.
One of the things is, and this is a kind of a 2-part comment from Jan Johnson. It said, she says statistically anyone under 19 has 99.9% of survival. We've talked about that. No vaccination there. She's not interested in that, but anyone who wants to do so they do so. But the concern comes in, I take it from reading here, she's worried about those who decide not to.
Right.
And without disparaging anyone from here, obviously, I know you're going to encourage folks to do so. But what do you say about folks who don't want to get the vaccine right now and just have their own concerns in general? Because you've heard that even from medical professionals.
Yeah. And different people have different concerns. I mean, some people are just distrustful of the whole process. Some people have heard things like, there's chips in some of the vaccines, and that there are conspiracies around what's going on with the vaccine. And the problem is that they don't know who to believe, right? They're getting hit with 4 and 5 different messages. So they're worried and they're a little concerned. There are people who feel like, COVID isn't going to affect me badly. I don't need a vaccine. But the reality is that we need as many people vaccinated as we can to stop the spread of the virus. So if you're 20 years old and you're an orphan who works inside of a sealed container and doesn't go out and ever interact with anybody, fine, right? If you accidentally get COVID, you're probably going to do just fine, right? But if you have other family members who may be higher risk, or have family members who have family members and friends who are higher risk, you could be part of the chain which transmits it. And so that's what we're after right now. we've gotten most of the high risk people, the people that are at risk of dying. What we haven't gotten is the people that are the high likelihood of spreading, and that's that 20 to 50-year-old age group. When we look at that age group, that's where we always have the highest numbers of people that are infected and the highest number of cases. So we're getting to a point now, if we can get enough people in that group, we're going to see our rates drop very dramatically.
And in talking about that, and you bring up a good point about that. There's a difference between those who get seriously ill and those who get the virus and can spread it more so. What are we seeing the effects? Obviously, it's somewhat early, but spring break, the bigger part of spring break just concluded. We're going to kind of the week 2 of it now. You expect to see a spike from the spring break crowds in our area here in the last couple of weeks?
This is the first time I can honestly say I don't know what's going to happen. You know, when we looked at what was going to happen over Thanksgiving and Christmas, we were all just kind of gritting our teeth and expecting a big surge, and it happened when we opened up things partially in July before we had a mask mandate. We were expecting that to happen, and it happened. But what we're seeing is that, there are a lot of people out there with spring break, and it could increase the numbers, but we're also seeing a lot of people getting vaccinated. And for a while, the rates of infection was dropping faster than what we expected. So we think that the vaccines have something to do with that. Now, as we go forward, it's really going to be next week and the week after, which will tell us what's happening. And if you look at our curve, what you'll see is that it dropped down very quickly, and now it's sort of flattening out. Although today we only had 32 new cases, so that's really, really good news. So I think the next 2 weeks will really tell us if we're going to have any effect from spring break at all. And then on top of that, we'll see how much of an effect it has. Does it have a big effect? Does it have a modest effect? We're just going to have to wait and see.
Let me ask, when you say that we only had 32 new cases today, how much of that is affected? Fewer people may be going in and getting tested right now. Is the testing rate staying the way it was before? Or are we seeing a significant drop on that? Because one of the things I heard just the day I went in to get my vaccine is that my first shot of the vaccine is that I heard folks saying, everyone's coming in for this. Now we're seeing the testing drop off. Like, can you talk about that? Are we seeing that effect? That kind of cause and effect? Oh, I can get the vaccine now, so I don't have to worry about getting tested.
Well, we see that as numbers go down, we've seen this every time. The numbers of people getting tested decrease. And as soon as there's that little bit of an inflection upward, the numbers go through the roof. So it's hard to know whether this is because people are getting vaccinated and don't feel like they need it, or it's hard to know whether it's just a reflection of the numbers going down. That being said, what we can do is we still had plenty of numbers to accurately measure the percent of positive tests. And so we were up at almost 20% at the peak. We would then drop down to about 15%. We were hovering around 10%. The last week or 10 days, it's actually been lower than 10%. So that percentage hasn't been dropping as quickly as I would like, but it still is going down. So all in all, the trends are looking good.
If you're just joining us, Dr. Philip Keiser, he is the local health authority for Galveston County, joining us here today. The big news that came out just shortly before we went on the air is that that right now, well, not right now, but starting March 29th, all of those essentially either 16 or 18, depending on which vaccine,
right?
But all those who are eligible to get the vaccine can go ahead and get so. And you can go ahead and sign up on the list now. The wait list through UTMB, which is that Galveston County Consortium. We should point out, we say UTMB a lot, but it's UTMB Health, Galveston County Office of Emergency Management, and the Galveston County Health District that are working in tandem to make this happen. So it's the three organizations making that happen that's doing that. You get on the list, you get the invite from there. The interesting thing is I after a while going off and not getting an invite, and then got my invite, UTMB, went in, got my first vaccination. I go in Sunday for the second. Now I've had other groups like UT physicians and others starting to text me left and right saying, come in, you're eligible, come in, get eligible. And I'm not the only one hearing that. It seems like now those high risks are gotten taken care of, folks have vaccines, so they're reaching out to anybody they can to say, hey, now you can start coming in. Along the ways, and so to do so. So again, if you want to get on that list, it's utmbhealth.com/vaccine or call 877-389-2318. And again, about 150,000, a little over that vaccine doses. That's and so we say that 18% are fully vaccinated, but about 50% have had at least one shot. So far. Now, if you think about that, that's just within a few months. I mean, December roughly is when we started this, but if you really look at it, it's January on February when we first got the mass vaccination site opened up in Galveston County, that it's gone that way. So again, everything opens up for folks there. I got a key question here. Sorry, from Adam Klee, I should say. He says, what is the effectiveness of these vaccines that are out there on the variant strains? We've heard a lot of mixed messages on that, whether it's the South African strain, the Brazilian or South American strain that's out there, the British strain. Now we even have, I think, a West Coast strain of some sort, or San Francisco strain. What's being looked at there already?
Yeah, so there's a lot of work being done looking at the different strains. And let me say hi, Adam. What we know is that the Pfizer vaccine works very well against the UK strain, that it has about a 60% decrease in terms of what we call neutralizing antibodies. These are the number of antibodies that kill the virus compared to the South African strain. But you got to understand what that means, okay? It's like, do I kill the cockroach with a 100-pound sledgehammer or a 40-pound sledgehammer? Either way, it's going to be dead. And so it works very well. Now, some of these other strains, we don't know the answer to that yet. That work is being done, and people are testing these strains very rapidly, as quickly as they can. The other thing is that we're worried about is actually there's a strain in Brazil which has come out, which has now reached the United States, where a town or a city in Brazil called Manaus, they figure about 70% of the people that were infected before this strain came out. And then when the strain came out, it came back and infected a lot of people again. So some of these strains certainly can evade the immunity that we have, but we don't know enough about how those particular strains work with these vaccines. We're going to have to wait and see. But the most effective way of getting rid of this is actually get everybody vaccinated now. So even partial immunity can help prevent transmission and can also help prevent getting sick or dying.
This came in from, and Karen, we just had this up. Karen Arnold asking, where can we get shots in Galveston County? She says she's already registered and I'm high risk. If she's one of those that hasn't gotten that invite yet, because right now, from what we understand from the release from UTMB to UTMB Health today is that if you're on that list, they're really going to get aggressive now on finding the folks that are in those high risk categories and getting those appointments now between now and the 29th, correct? I mean, that's going to be kind of an emphasis between now and March 29th.
Yep, that's absolutely correct. And I would also tell her is that if she hasn't heard anything, call that number. Somebody can go in and make her an appointment.
And again, Karen, the number there for you, Karen, 877-389-2318. For your question, it's probably best to call the number to get the help there. And then they at least get you to somebody, because the online registration is just an online registration. There's not that direct back and forth. And you talked about the J&J. Someone's asking you here, Kelly Foster's asking, where can we get the J&J vaccine? And again, they had 4 million. Now they're up in their production. Is that something we probably see instead of, like, say, through UTMB or the Galveston County Health District? We're going to see more of that out into other clinics as they come along, the CVS's, the Walgreens, or even kind of the smaller clinics out in the rural areas.
Yeah, that's what we expect to happen. Unfortunately, we at UTMB, we shot ourselves in the foot by taking the Pfizer vaccine because now they're going to keep giving it to us because we have a lot of capacity and we've managed it very well. So we fully expect to continue to get the Pfizer vaccine. As far as the J&J, I think it's exactly what you said, because it's one and done, and because it doesn't have all the cold storage requirement. We're going to see that being given in a lot of different places for quote unquote hard to reach populations. And so don't be surprised if you see it in schools where people are getting vaccinated. Don't be surprised you see it being used in homeless populations and other types of areas where we can only get the people one time. That being said, we'll see. I'm constantly being surprised as to what comes down the pike and how often we get it in our hands.
And speaking of other places, and we should note here, this is from just this morning. This is actually over at Ball High School at the teen clinic there. This is at Moderna. Galveston ISD got 100 doses of the Moderna vaccine available. They're mainly doing staff who work for the school district today to get that vaccine. You had said before we came on the air that we'll probably see more and more of this now, that will move away from the mass vaccination sites and the large vaccination sites to some setups like this, because Galveston ISD officials said they would like to see the teen clinics. So there are several of them across Galveston ISD to be used that more often.
Yeah.
For the way to do so. As you can see, this gentleman here is about to get his vaccine. He got a nice little orange Band-Aid with it too. Thanks to Paul Deaton of our staff who got over there to get this today. Can you talk about that, about how we may see, instead of the lines at Walter Hall Park, that we're going to start seeing, setups at different clinics and more accessible areas across the way?
Yeah, sure. In fact, that's the way we expect this to end. Generally, we don't have big drive-throughs to get people vaccinated. We just tell people, go to your doctor and get a vaccine. So as vaccine becomes more available, we're going to want to put more into clinics, into pharmacies, into anybody that is been approved by the state to handle that particular vaccine, to get it out there. We will expect that, UTMB will have appointments available. The county health district will have appointments available. Clinics like the teen clinics or other, coastal health and wellness, private practices will have appointments available and have vaccine available. And then the pharmacies will have vaccine available. Keep in mind that it is extremely difficult and extremely time and labor consuming to run these mass vaccine sites. Not only that, we're actually coming up against hurricane season, which is going to be starting June 1st. So we want to be done doing that before hurricane season starts, because otherwise it's just going to be a real disaster if we keep doing it that way. But I think we're going to be there. I think we're going to be there because there's more vaccine available. And so what I expect to see is that as demand starts to decrease and supply starts to increase, we will start then contracting what we're doing at the mass vaccine sites and pushing more out into clinics and getting back to a more normal situation.
So does that mean there would probably, there was discussion at some point about having a site at the fairgrounds in Hitchcock, or even the cruise ship terminals, that we're probably not going to see that now as we move forward? That we're probably
I don't think we're going to see big sites, but what I think we will see is things like going out to the fairgrounds to try and do some small events, 400 people or so. We're going to be targeting, in terms of going out, we're going to be targeting those zip codes where people have not gotten lots of vaccine. And there are lots of reasons why people don't want or can't get the vaccine. And so those will be targeted for those specific areas. We'll be working with churches. We'll be working with community groups. And so don't be surprised that, you can go down the street and get it to your doctor's office, or, your church is doing it on Sunday and you can go get it on Sunday. So that's kind of the way we're thinking this is going to end.
Got a question now. This is from Junior Leha. He is actually a councilman over in Santa Fe, but also big on veterans issues. He says, is there a strategic campaign to target veterans in the county? That's something we have not talked about really. I know that the VA clinic was offering some assistance and giving some vaccines about that, but is there any type of program to work specifically for for veterans in our county. Although many of them, may would fall in to the high risk categories and should have gotten an invite there. But is there some type of system for the vets right now?
We as a health department and as a consortium have not specifically targeted veterans because the VA actually opened up to all veterans several weeks ago. And I honestly don't know whether they still have vaccine to do that. So I'm going to have to check on that before I tell people just go to the VA clinic and they can get their vaccine. But if not, we can certainly then target veteran groups. But, that's the sort of thing where, you can target veterans groups, you can target the DAW, you can target, the Veterans of Foreign Wars, any group that wants to do it, we're interested in working with and trying to push it out to folks who may be a little reluctant, maybe not sure, need a little coaxing. We want to work with you.
And good. Thanks, Junior, for that question too. By the way, it's a good one. And while Dr. Keiser is following up with that, we're going to do the same thing here. It's not, it's not something we've asked about specifically here, but we will do so along the lines. Thanks for everyone for joining us today. Dr. Philip Keiser, the local health authority for Galveston County, on with us for his weekly visit. By the way, this week and next week will be on Tuesday instead of our normal Monday. Dr. Keiser is finding his schedule really booked on Mondays. That's the top secret meeting that got the big announcement today for that. So thanks for that. But it will be again next Tuesday. And a reminder too, folks, is that coming up tomorrow, not COVID related, we do have our Healthcare Unmasked show at 1:00 tomorrow. And we're talking about another important health issue there, and that's dealing with colon cancer. And this is March's colon cancer screening month. So we'll be doing that coming up tomorrow, just as a reminder there. One thing I was going to ask is that we got summertime coming. Folks are going to want to hit the beach. They're going to want to head out. They're going to want to go into restaurants. We're going to, and obviously Texas has lifted the restrictions. Do you think, given with what we know now and the percentage of people getting vaccinated and many of the businesses, restaurants particularly, are keeping a lot of these social distancing requirements and masks and the like in place, do you think that when I would suspect we're going to see a surge, but probably not as severe as it would have been, say, a year ago, if some of the same elements existed?
No, I would agree with you on that. I think time is going to tell what's going to happen and how well this works. So I think we have three scenarios ahead of us. One is that we get a lot of people vaccinated. It works perfectly the way we expect it to, and COVID goes away by summer. Okay. That's probably too optimistic and rosy about that. The other scenario is that we get a lot of people vaccinated and the vaccines work really well. And so the level of COVID becomes much smaller and manageable. And when that happens, what you're going to see is a very different approach on part of the health department, where what we will do is we will go out and we'll find these, isolated or clusters of cases. We will quarantine these people, not tell you, you need to stay home. We're going to tell you, you shall stay home. And if you don't, you're going to be in trouble. And then we'll offer vaccine to people around them. That's probably a more realistic scenario, which will probably stretch all throughout the summer and the fall. And then there's the kind of like the, oh my God, what happened scenario. And that is that one of these variants comes through that is not well controlled by the vaccines, in which case what we will see is we'll probably be ending up in the fall, then opening up a lot of these vaccine centers again to give people boosters that give them that additional immunity. So, where is it all going to fall out? Probably somewhere in the middle.
And when you talk about boosters, that's one of the things is that we haven't talked much, and I know we're going to bring on UTB experts here pretty soon to talk about this, but there's effort that it's underway right now to actually improve the existing vaccines.
Right.
In many ways, everything from being able to go to single shot to storage requirements changing to we're starting to see for the first time now those younger than 16 being part of the clinical trials. Can you talk about some of what's being done on the vaccines as far as improving already what exists there and what we see down the pipe in, say, the next few months or so?
Yeah, so Keiser is actually working on a way so that it doesn't have to be stored at -80. And so, the Pfizer vaccine and the Moderna vaccine are virtually the same, except that Moderna has a different, what we call carrier. That is the solvent that the vaccine sits in, that it keeps it so that they don't have to freeze it so coldly, and makes it not quite as light sensitive as the Pfizer vaccine. So Pfizer's working on that. So don't be surprised if we see a Pfizer vaccine that just goes, minus 20, or even, freeze it, and then it can sit in the refrigerator for up to a month, which is what the Moderna vaccine is. So that's one. The second thing I think you're going to be seeing is obviously kids. Those studies will probably be done before school starts. So we will know certainly earlier on that kids over 16 or under 16, but say age 11, pretty quickly, I think probably within the next several months, that we can give vaccine to them. And then we'll see the next group of school-age kids up to about 5 or 6. And hopefully we'll have that information before school starts. We'll have the dosing done right. And we'll then actually start doing vaccine campaigns in schools to actually get the kids vaccinated, not just the teachers. So that's something to come. Some of the interesting things I think we're seeing is, as we look at these variants, the RNA vaccines can be altered very quickly to change them so if there's an amino acid change on one of the proteins that the virus has, you can change the RNA so that it fixes that. And so it generates an immunity against that part of it as well. So we may see some new variants of the Pfizer and the Moderna vaccine on top of that. And finally, just recently, the AstraZeneca vaccine is being paired with Pfizer to see whether it matters whether you get a Pfizer vaccine and an AstraZeneca vaccine, a Pfizer, and we'll see more of these mixing and matching and combinations. And I think the hope is that by using 2 different methodologies, even if you have to give 2, you actually get more immunity or more long-lasting immunity. So those are the things people need to keep an eye on as we go forward.
You bring that up because it really in the flu world, it already kind of works that way. Does it? I say flu world, but the flu vaccine, that's actually kind of the way to what you may get your normal flu vaccine, and then another one's developed that deals with a certain strain. That's not always the same company, the same that's a different flu vaccine at that point.
Oh yeah.
And that's commonplace. You get the different shots and no effect, but it has to be studied out in the first place, correct?
Right. That's right. And, so for flu, every year, somebody predicts that it will be, this much of influenza A and this much influenza B. And then they make the flu vaccine, and they're made by different companies. And so each one's a little bit different. And then every now and then it turns out that flu vaccine isn't good against the flu strain that's circulating. And they have to make a whole new set of flu vaccine, which you have to give out to people very quickly. So, stuff like that happens. And don't be surprised if we see it happening with COVID.
I wanted to get your opinion on this as well, because there's been a lot. I mean, you encourage mask wearing. We have talked about it that maybe the better approach would have been to encourage it in the first and then bring in regulations after, but it's kind of a learning process. Really the last time we had to think about something like this was 1918 through 1920. And I've read old newspaper articles, and you brought it up to me too. There was an anti-mask group that back in the mid 1900s, I should say 1918 and 1920 or so. Obviously, our county made a lot of interesting news this week, particularly one lady in person, in particular, about the businesses having their masks. You encourage folks to have their own regulations here, but. Along the line, but can you just talk about this type of visceral reaction we're seeing from people? Because we're also seeing it online in the comments right now about the vaccine, but can you just talk about this part of things? This just people just out and out, I don't want to question anyone's motives, particularly on the vaccine, if they want to get it or not, but on no matter how much information is put out there, how difficult it may be for folks to accept it.
Well, we know that we've done polling, and other people have done polling, and we know that there's a pretty hard no, about a quarter of the population. And that's okay, because we don't think we need to get everybody vaccinated in order for this to work. And in fact, if it works the way we expect it to, they'll get the benefit without having to be vaccinated. And again, that's fine. We're not out to single out people or force people to do things that they don't want to do. With regard to masking, it is my belief, and I think we have good evidence for it, that masking does help prevent transmission of COVID. And not only does it help prevent transmission of COVID, it prevents transmission of influenza. It prevents transmission of tuberculosis. How do I know this? Because we haven't had a new case of tuberculosis probably going on 6 months now in Galveston County. That's unheard of. And we haven't had our numbers of cases of influenza have been minuscule. So these things actually are effective, and they do work to help prevent the spread of things that are coming out of the nose and that are aerosolized. With regard to people's private property and personal property, we tell people, at least I tell people, encourage people, have your own rules, try and do what you think is the right thing. There are some people who feel like, I don't need to, and I don't want to ask people to wear masks. That's fine. We're not going after them. We're not arguing with them. We're not telling them that they need to do so. But on the other hand, if you own a business or if you own an establishment and you want to have masking or other types of rules in place on how you're going to run your business, you absolutely have a right to do so. And what we've seen in terms of people that are getting in trouble, what really is happening is that they're not respecting the business owner's wishes. And again, that's not coming from us where we're forcing people to do anything. That's what the business owners wants. And I think to their credit, the police are enforcing trespassing laws and other types of things. Just like if you went into a business and started taking your clothes off, and the business owner told you to stop doing that, and you didn't keep doing it, you'd probably get arrested, right?
Right.
And we see things like this happen all the time. It's nothing different. It's nothing new about it. So the Daily News actually did a poll where they asked people, what do you think of this? And 82% said that we should respect private property rights and business owners have a right to do that, even though only about half of them said that you should require people to wear masks, right? So even people who don't want to wear masks understand that people have a right to do what they want to do with their own property and their own premises and on their own businesses.
If you owned a business right now, what would your requirement be?
I'd ask people to wear masks. If I had a restaurant, I probably wouldn't fill it up. Right now, I feel comfortable, sometime around 75% rule is pretty good. I've been in restaurants where they filled up and they've done it very well. You sit in a booth and you have screening and you're not really in each other's face. And so a lot of it really depends on the individual establishment and how they do it. And again, so that's why we want to make sure that flexibility is there so that if people have creative solutions which protects themselves and their workers and their customers, that's great. That's what we're after.
Dr. Philip Keiser, local health authority, Galveston County, on with us for his weekly visit on COVID-19. Big news day about COVID-19. If you had missed it earlier, opening up the eligibility starting March 29th, all those eligible. So essentially 16 and older for right now, there, no matter what your health conditions are, no matter age or anything at this point. And I'm proud because that's kind of come up. I read an interesting opinion piece in one of the national publications about that maybe outside of the frontline workers in the early month or so of that the making the age restriction part may have been a downturn to this as well. I just wanted your take on that. Should it have been more opened up earlier on, or do you think of how it was handled with age and health conditions being the primary determiner? Was the better plan here?
Yeah, I would have liked to seen something where we could focus on age, but also have flexibility. So initially we were focused on greater than 75, but remember, from a public health point of view, it's shots in arms, right? And so we've always taken that point of view. Number one, get every vaccine that we get every week, get it used. Number two, get the high priority groups. Number three, get those groups of people that are hard to reach and difficult to reach. And that's something that's going to be ongoing for a long time. And so had we had the flexibility and we could also get the message out that we have flexibility, I think what we've been going through in the last 3 to 4 weeks where, some days we struggle to get rid of all of our vaccine, we wouldn't have had that. We'd have had a lot of people that were on the list and we could have just work them through. We're doing that now anyway. If an 80-year-old signs up today, they're going to get vaccinated. They're going to go to the top of the list. But there's not that many 80-year-olds out there that haven't been vaccinated. So we're still working through them. And if you know people, sign them up. If they can't sign themselves up, You sign them up, have them come in with you, call the number, they'll make the appointment for you. So we have a lot of things out there to do that, but having that flexibility, I think, based on where you are would have been very important, because every time we run into, we don't have enough 75-year-olds and we're getting frustrated, a week later, the state changes the criteria. And so we've been a little bit ahead of the curve the whole way, and it would have been a little easier for us to have been able to make that determination on our own.
Dr. Philip Keiser, local health authority for Galveston County, has been on with us again. If you have not done so yet and want to be eligible to get the vaccine, and one of the 3 vaccines we should point out here right now, primarily 2, Pfizer and Moderna, you can go to utmbhealth.com vaccine. Now that's the central site. That's UTMB Health and the Galveston County Health District, along with the Galveston County Office of Emergency Management, the consortium that's working on that. Or you can call 1-877-389-2318 to get on the list. If you're not on there, if you're already on the list, you should probably, we're going to see a lot of folks that are on the list that are fall in that age category of 50 and older from a flood are going to start seeing those text messages come through pretty heavily now. So it may be a little busy going along the way. I got to tell you, I know I joked about this off the air before you and I came on, but I find it interesting of all the things y'all thought about in that consortium of how we're going to get people vaccinated and do it. And I jokingly had said, well, you should do this, right at the Bolivar Ferry. You said that actually was discussed at some point.
Yeah. No, well, we haven't ruled it out. I mean, but if we could get ourselves a bunch of J&J vaccine and stand in line at Bolivar on Jeep weekend, let's say, okay, and we'll work out a deal with the ferry is that people get vaccinated, get on the ferry first, and we'll just go down the line, bam, 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 one shot, one and done. Have some medical personnel on the ferry so that they can watch those folks as they're going over, make sure there's no problem. Why not? We're going to have to be doing creative things like that in order to get all of the people that we want to get vaccinated.
It sounds like an interesting way of doing it. If you ask me, it makes sense. A big popular week, Mother's Day weekend being another big one on the Bolivar Peninsula, as the Go Topless, the Jeep weekend down there as well. Yeah. And the summer goes along. I mean, you've got the natural wait time built in and everything else that you need there. So
that's right. And we can get them coming and going. We can get the people going. And then at the end of the weekend, we go to the other side and said, have you changed your mind? We'll get everybody.
The only thing you can't do is no, you don't get to go back now unless you get, that's not going to happen. Don't worry about that, folks, along the lines. Anyway, so that's just an interesting concept. If we do that, I want to follow up with you. Dr. Philip Keiser, local health authority, Galveston County, has been on with us for his weekly visit talking about COVID-19. Join us again. It'll be Tuesday. He'll be on with us next week to talk about these issues again. Hopefully you have some more big news again. I know when this came out, you were calling me right away to say, hey, we're going to get this word out.
So excited about this because this is the last big group we've got to do. And then after we get done this, we'll be looking at ways to move it back into more the realm of normality. And I think once we get this group, hopefully we're going to see some big changes in the transmission of the virus.
You said it took big stressors out by going this route.
Right.
Can you elaborate on that a little bit?
Yeah, so if you've got a wait list with 100,000 people on it, and you've got 15,000 people over 75, and the state's telling you can only do people over 75, that creates tension, right? And it also means that we got to figure out ways to say, okay, well, we'll do the over 75s, plus we'll do people with comorbid conditions. Okay, what are the comorbid conditions? Who's to say this comorbid condition is worse than that comorbid condition? So we know who to get in, and we have all these people who want to get it. And believe it or not, I can give you that list of comorbid conditions that the state puts out and sit down with 5 doctors and sit down with 20 names, and you will get 5 different opinions over what order we should do those people. Because it's not clear. And so it creates a lot of stress. It creates a lot of tension. It creates a lot of stress in terms of how do we get this message out to people? We're trying to be as transparent as we can. But how do we get this out in a way that they understand and promotes people signing up? And so the situation we faced over the last couple of weeks is that we can't do people under 50, but we got a lot of people under 50 who want it. We got a lot of people under 50 who haven't signed up because they think, well, I can't get it. We have vaccine appointments not being filled. So then we have to start doing things like calling people up, sending out email blasts, sending out lots of other types of communications to get people in those bays and so that we can get them vaccinated. So now what that does, it takes all of that. Who should we ask? How should we ask them? It just takes it all off the table. It's real simple. It's y'all come on, we're going to vaccinate you. When we start getting to the point where we're not filling up those slots, we know it's open and that people want to do it. We'll just then start going to an open appointment system and start scaling down.
Dr. Philip Keiser, local health authority of Galveston County, on with us as he does each and every week, talk about COVID-19. And at some point, we'll be talking about something other than COVID-19 for now.
Hard to believe.
Thanks for coming on with us, Dr. Keiser. We appreciate it. Continue watching here, folks, on I-45 Now.